It's a great day for optimal health. Today we're going to be talking about some new research that affects almost every single American. The research shows that the FDA found that there was an actual carcinogen, cancer-causing substance, found in over-the-counter antacids, acid blockers, things that most people take at one time or another, that this chemical actually causes severe damage to the body. In fact, so much so that when the FDA reported this here toward the end of 2019, many companies, retailers such as CVS and Walgreens and others, pulled these products off the shelves. Let's find out what they are and what you can do about it. So in September of 2019, CVS and others have taken the product Zantac and other ones off the shelves, products that have an ingredient called ranitidine in them. The reason is that these types of acid blockers, antacids, anything with some of these acid blocking or ingredients that actually neutralize the acids contain this ingredient called nitrosodimethylamine. Now, NDMA has been found to be in ranitidine, the Zantac, Percocet, any of those types of products, and that it is a possible carcinogen to the body, cancer-causing. But it actually goes a little bit further than that. They've actually found that 1 in 3 adults in the U.S. take these types of medications, and they've also been linked to depression. That's crazy that they've been linked to depression. We know they have cancer-causing problems in them now. And so many retailers took them off the market, but yet it's kind of been slid under the rug. The fact is that even though it might be cancer-causing, there's some new research out that shows that actually they can significantly increase kidney disease. Now there's a new study out that shows that antacids and these acid blockers can actually cause kidney damage, and we weren't quite sure exactly how much or what the effects were. And there were some researchers at UC San Diego that determined that people who took these types of medications for heartburn, for acid reflux, were more likely to experience kidney disease than people that took other things like just probiotics or enzymes and those types of things. Now, even though that research focused on those products and it was like, wow, maybe we should worry about it, is actually a step further. There was some new research that came out that showed that these drugs, that these antacids, these acid blockers that people were taking thinking they were actually fixing a problem, actually really increase the risk of kidney disease, stomach cancer, and heart disease. And so all of this was proven through a lot of these studies. Researchers at Skaggs School of Pharmacy, Pharmaceutical Sciences, University of California, San Diego, a lot of these different places, universities and that, were able to compile the data to come up with this information. Now, if you think about it, why in the world are we taking these antacids and these acid blockers anyways? It's because we are not digesting our food properly. And when we don't digest our food properly, we have indigestion, right? Not digesting properly. But we really have two choices when we have indigestion. Either we finish the process, so all the nutrients from our food can get delivered to the cells for energy, for metabolism, for fat burning, for mindset, for everything, for longevity, or we stop digestion and none of the nutrients get into the system. Now, both stop the pain, the pain of heartburn, of the indigestion, the gas, a lot of that. They both can stop it, but only one way, finishing digestion, actually helps with your health. And now we know through the latest research, not only do we lose the fact that we're not delivering nutrients from our food by taking acid blockers and antacids, but we're actually causing major damage, that we actually we are increasing our risk for kidney diseases, for stomach cancers, heart disease, and those types of things. So we need to get rid of it. So what do? Because we want to get rid of the pain. Well, as I mentioned, finish digestion. Well, how do we do that? The reason that we have indigestion almost in every case is because we're not breaking those foods down to the usable substances of amino acids, fatty acids, and glucose, as we mentioned. But the thing that breaks the foods down for us are called enzymes and somewhat probiotics. Enzymes are in food that naturally break the food down so that we're able to have the benefits from it without our body doing a bunch of work. And if our body has to do a bunch of work because all of a sudden the enzymes are not present in the food, then it takes energy away from our body and we don't do it very efficiently. And when we don't do it efficiently, that causes heartburn, the gas, and all of those things. So we just need to make sure we eat food that have enzymes in them. It's that simple. And raw foods contain enzymes. Anytime we cook food over 118 degrees, the enzymes are destroyed. So just become a raw foodist, right? Well, some people even say, I eat raw food and I get gas. Or I have a salad and I get gas. That's true. That might happen sometimes. But only if we're not releasing the enzymes from the food. Remember when Grandma said to chew your food and chew it more? Like when you think you're through chewing, chew it again? She was right. Because food, when it's raw, still has to have the enzymes activated. And to activate the enzymes, you have to break that membrane. You have to chew it well so the enzymes are activated and it digests the food. If you think about an orange, it has membranes in it. You can see them and you peel it out. Every food has those. It's just like in broccoli in that they're so small, you don't see them. You have to really chew it to break those up to release the enzymes to digest the food. So number one, chew your food more. Eat more raw food. But when you don't, almost everyone cooks their food at some point or has some processed food. You got something from a box or a bag. Well, those foods, the enzymes have been destroyed. They've been cooked over 118 degrees, or it's just the processing of using ingredients that are enzyme deficient. In those cases, you just need to be responsible. Add back the enzymes that were naturally occurring in the food. Take a good plant enzyme and probiotic formula. If you do that, you'll improve digestion. And so now we won't have indigestion and stop it that causes all these problems, or taking the antacids and the acid blockers that can cause major disease. We can finish digestion naturally and get all the nutrients delivered for optimal health.